Hi everyone, welcome to our discussion. I'm Fook and these are my colleagues.
Hi, I'm Peter.
Hi, I'm Michelle.
I'm Trista.
And today we're going to talk about the two articles that we read over the weekend. And the first one is Internet searches for opioids predict future emergency department heroin admissions by our professors Sean D. Young and then Kai Zhang, Larry F. Chu, and Keith Humphreys. And so the article argues that internet search-based models like Google Analytics and Google Trends should be utilized as a way to gather data about people who search for heroin and opioid-related topics, and use that relationship as a way to determine the number of emergency department visits, as well as plan for public health issues for the future, and relating to the drug. And yeah, so did you guys find anything interesting about it, something that stood out from the research or methods that they did?
Well, I thought it was good to see the test size, where they tested, how long they tested. It was very specific in terms of explaining the background that developed the model. Where in the online article that we read, it was the role of predictive analytics in clinical care, where it talked about that, just saying that we always need to be considerate of when we're looking at these studies and these models, that we kind of have to keep in mind clinicians and patients, that who was doing the data, what was the test size, was it targeted, how long was it done for, that kind of thing. So I thought it was kind of an interesting little contrast, seeing that.
Right.
I think for the opioid article, it's kind of not accurate in the sense that they only had cities that they.
Certain cities like San Francisco and Minneapolis.
They didn't look at rural areas, and also one of the search terms was brown sugar, which is also for baking, so it kind of skews the results.
Oh yeah, brown sugar. Oh, that makes sense.
That's a good point.
That's a good point. Yeah.
So in the results, we saw Minneapolis had the largest annual percentage increase from 2005 to 2011, and San Francisco had the lowest, or the largest annual decrease. And when you compare the percentage increase to the search term increase of searches.
Yeah, there's a correlation.
There's a little correlation there, so that's kind of interesting. So
yeah.
Do you guys think that actually correlates, or is that just
correlation is causation kind of thing?
Yeah.
Could be, yeah. I mean, could be, but it's always what did they say? What do they say in economics? Correlation is can't always be, it can never be causation or something like that. But
it doesn't imply.
Yeah, it doesn't imply causation, but yeah.
Or it's just because it matches the terms, you have to kind of look at it in context. Where it's you can't just pull data from everywhere that matches what you're looking for, and you're not going to get a guaranteed match for everything every time. So it's kind of you have to sort through all of that data and kind of determine what is useful, what isn't, and what's going to because that could completely alter your model and your algorithm that you're using if your data isn't accurate.
Something I thought about too is in 2005, there's probably less people using internet.
Oh yeah, definitely,
Yeah.
As you go on, people search up more stuff.
Yeah, because accessibility in terms of plus
that's
the metropolitan
that's a very good point.
areas.
Yeah. Definitely. So the second article, the role of predictive analytics in clinical care by David Alfandre. I don't know if I said that correctly, but the author talks about the emergence and improvement of electronic medical records, or EMR data, and how a method called predictive analytics uses machine learning algorithms in order to forecast and predict future health-related events. So what do you guys think about the PA technology? Do you think it's similar to the first article, where it's kind of not as effective, or so?
I think the article argues more that it's less effective, or it shouldn't be treated as
the one true.
Fundamental.
Yeah.
Because there's a lot of bias and more potential for misuse too.
I found that really interesting, where they talked about misuse, because sometimes, do you guys know how the opioid crisis started? Because in the company Purdue, basically bribed doctors, and they bribed an FDA agent to approve their drugs, and then they lied about the drug, saying it's like only 1% addictiveness, only has a 1% addictiveness, but it was like 13% addictiveness. So yeah, they bribe doctors to like prescribe it to their patients and stuff, and there's like a lot of misuse and abuse of their roles. So I found that really interesting about this article too. I feel like when we create technology that relates to sensitive information like that, we should definitely like take that into consideration. Yeah.
We need to definitely be more careful with it. I think people in general are kind of treating it as this great thing that somehow is going to solve all of our problems, when really it's just a tool that we need to be careful about how we use it and how we use it to solve problems.
Yeah, it can be one part of a way that can help us.
Yeah.
So you think like PA will be like additional like data to help like physicians and stuff, or do you think it will be like the solution or the answer to like, you know?
I think it's like just additional data to make a decision, because like you can compare like how this decision would like change the outcome of like the patient in the long run.
That's it. Yeah,
I agree with that. It's just another tool that could be used to help people, or it could be used in another situation where a company could say, hey, you know, we're going to deny insurance claims to patients who match, you know, our data analytics for this model because they're too high risk for us, or you could have other kinds of situations where it could be used for good or for bad.
Yeah, definitely. That is the challenge, and in my opinion, for the field of informatics, as technology and data and healthcare grows, like we need to ensure that the bridge we build is safe, like and secure for everyone to cross. Okay, that's all for today. Thank you guys for watching. Bye everyone. Bye.